Hi, this is Dr. Vasquez. I am actually doing an annual report sort of discussion, sort of to let people know what happened last year. I think it's important for us as an organization, not only internally to kind of relay the message, but also show others that the work we do here is pretty different, and we're actually accomplishing a lot of things that we hadn't really thought about, but actually just coming to the mix. So dreams into action, and I think that's pretty interesting. Now we have a new website, which is G Health Enterprises website. It ties in GBON, the Jabaco, it ties in the Urban, it also ties in the IPA, which we've had for a while. And I think some people often get mixed up as a result of it, but that's what we want this clarity for. So we'll kind of go into sections, and you're going to see some of these things kind of pop up behind me. The first thing was that Urban expanded to the east side, and I think that full impact has been pretty good. We've been growing. The visits have been growing in terms of numbers, but more importantly, we've been combining the GBON component to Urban on the east side, and that's something that was needed, and it's coming along pretty nice. The next stage of last year was GBON and Urban were the first practices in the state to really develop this kiosk model. And when we were deploying this stuff, it was just sort of hit and miss. But the check-in and the screening tools that we've used, on the Urban side, we've gotten a lot more experience, and it's worked out really well to kind of make sure the documents are being done. The same thing's going to be deployed on the GBON side as patients are coming through to make sure that all the documentation is working the way it needs to be. The interesting thing was that the American Heart Association awarded Urban, which is part of G Health, the Target BP Award, and that was out of 1,600 different practices that submitted. And you had to have your population, 70% of your hypertensive population controlled, and we were able to do that within the Urban Family Practice site, which is kind of remarkable for an area that has patients with high acuity scores. And what high acuity scores are is patients that are really sick, that, you know, a lot of physicians or groups will tell you, we have the sickest patients. Our acuity scores were the highest than any other practice here in Western New York, and we were able to accomplish that. So that tells you the good work that the individuals are doing at Urban Family Practice on both the east and the west side, and it really impacts the community. So the community gets the benefits of the work we try to do. The other thing is we often have a third-party sort of entity that reviews how well we're doing, and that's on the provider side and on the practice side. And you can see based on the numbers that we've done fairly well. In some cases, we're not national average, but we're at 90% within the categories, and our staff has been working diligently to improve on these measures. And you always saw progression throughout the year. So I think the more we know about these things, the better we're going to get with improving our services. The other side, on the Jabaco side, we for the last year, we're getting the numbers, and they'll be part of more of the annual report for 2019. But we were able to see that the value-based program is actually working, and it's been doing fairly well as a result of the work that we did. The different groups, especially the IPA, ended up with 13 out of 15 measures, which was good. The ACO in general ended up with 10 measures, and as you can see, with 10 measures, we can expect to get 75% of the share savings. The numbers won't be calculated to May of 2019, so we'll be able to do that. But for now, we've been able to give the providers back quality incentives adding up to about $488,000, and that's a good thing. And we hope to have share savings anywhere in the $200,000 to $400,000 range. That goes back to the provider bases that are providing services. And this is in addition to their fee-for-service, so it's quite successful. Again, we were a value-based level 2 that took on $500,000 risk, and we were able to get these types of results. We're the only one in upstate New York, and we were successful at it in this category. Not a lot of groups, especially grassroots groups, are actually achieving these kind of metrics, so it's been really good. The other side is, because of our partnership with YourCare, the ACO was able to participate in 2 grants that were basically available for vulnerable populations. One of them was the medication-assisted opiate-related program that addresses the deaths that are occurring as a result of the opiate. So we designed a different model to integrate behavioral primary care. Urban and Endeavor play a major role, so does YourCare. And what we're doing with these individuals is really providing them with the medication, but changing the way the medications are delivered. So we're getting more into the shots and the IM shot. So we're only 1 or 2 or 3 practices in Western New York. Dent was the first that's using this form of delivery system, which makes it a lot easier for the patients to get their medicines, and then, so you don't have to kind of chase around. To treat patients with Suboxone is very difficult because you have to count the tablets or the strips. You've got to get tox screens and do all that stuff, and by giving them injections, it kind of alleviates or make the system a little bit easier because compliance is pretty much better. You're giving them 1 shot a month. They don't have to kind of depend on doing a lot of this stuff on their own, and they're more comfortable also. And I think what we're going to show is that it's actually easier to kind of get these individuals into a remission kind of model so that they're not going back and using the drugs once they finish getting treated. The other entity that we dealt with also was the HIV population, where we're kind of making sure that within the group we're treating, and that's a separate program, is to get them to viral loads of 0. So we've given them Medicubes. We're playing a lot in that space with these little boxes where the medicines go in to make sure that these patients are taking the medications. A lot of times the HIV medicines are very difficult to take because it's a lot, or just the timing becomes difficult. And this cube actually gives us information back to the base to make sure patients are taking the medications. If not, we're notifying them to make sure that occurs. So that was interesting. One of the interesting things too is, as of 2018, Tobacco became the only New York State NCQ accredited ACO. And then in the country, there's only 5 with NCQ accreditation. It's really difficult to get that accreditation because you have an agency that's independent that comes and looks under the hood to make sure that you're doing everything across all categories of what an ACO should be doing. And we did it. And that was a sort of our team, our ValueBased team, deserves a lot of the credit for what they did. And again, we want to thank them for helping the system kind of change and grow the way they help us. I think when you look at the value-based quality metrics, one of the things that I found that was quite of interest was that we really changed the metrics that we had. In some cases, the ACO did better than the 12 national metrics, which is crazy. I mean, when you have something where we're doing this for the first time, and we brought 5 different groups, so we were bringing together the IPA, which Urban is part of. We brought together Jericho and FQAC. We brought Western Medical Group, which was a group practice of about 40 providers. We brought ECMC, primary care clinics. We brought Kaleida, primary care clinics. And having all these groups together for the first time and accomplish this goal as a whole, it was really good. But then when we started comparing it to the metrics, again, the ACO in general beat 9 of the state metrics and 12 of the national metrics, I think. And the numbers that you can see in the top are pretty dramatic because the metrics are focused around primary care, which means that any primary care prevention was there, mammography and colonoscopies, in addition to wellness exams. But then the chronic diseases were also built in, where medications for blood pressure and blood pressure control, diabetes, which is crucial, the different preventive measures to pick up on some of its complications, statins which are used for cholesterol treatment. All those are very, very important. And we as a system were able to kind of show quite improvement, and the gaps in care they improved throughout the year, which I thought was really cool. The last component was GBOM. So GBOM, which as most of you know, is what a lot of everything is built around care coordination, or GBOM, has done really well. We kind of always have done things and not waited to kind of so we were never graded, but everything we do, apparently when they put the first scorecards, they put out and found out that out of the 29 health homes, only 2 they gave a 5-star score, and GBOM was one of them. So everyone was kind of saying, what happened here? How did they do that? I mean, not only were we number 6 in the state in terms of size, but to have that kind of quality shows that what we're doing is real important. The other thing too is we're the only health home probably in the country with an NCQ case management accreditation. That's a separate accreditation from the ACO. And these are things that, again, they're coming in and making sure that we do case management the way case management is designed, and we've always done we've done well. So we're actually, this coming year, going after a recertification, which was interesting. One thing I forgot to mention is Urban Family Practice is also with the IPA. All the IPA doctors are PCMH credentials. That's through NCQA. Certain things that you have to do within the practice. Urban in itself also is accredited by NCQA for diabetic and hypertensive and stroke prevention, which are all good other certifications that you have to show that you're doing good work. So, because sometimes we're seeing entities like Urban sees about 26,000 visits a year, and in the provider base, and you just want to make sure that patients aren't just seen, but we're actually going after providing better care, and the numbers are showing that we are doing what we said we were going to do. I think the other things too that we try to get into last year, or of 2018, was more on the telehealth side. Everything in 2019 is going to be heavy on telehealth. So we develop our platforms, we develop a way for the electronic record, MedDent, to be able to do telehealth visits. So now the patient can actually call or through their portal schedule a telehealth visit, get a link, and we can communicate. And that's used as a way to record this. Also, it can be asynchronous. That means the patient can go to the portal and through an e-visit put information in, and when we get to them, we can either set it up as a telehealth or just answer the questions. You may be calling in for things like appointment, but more importantly, you may have a UTI, a sore throat, need medications, things that don't really require you to come in sometimes, and we can handle this stuff over the phone or through an e-visit and basically figure out you may have a sinus infection. This is the sinus information. We're going to put you on some antibiotics. We want you to follow up if you're not better in so many days. So it's changing the way we deliver care, and that's becoming more and more the norm, especially in 2019. The other things that I found that were important too is we have our PHNs, and we trained our PHNs to be able to do the care coordination, go out in the field, but at the same time to help with inpatient ER and redirecting individuals. Urban now has after hours, Monday through Friday. So for that, in the IPA group, we developed a system to actually, if a patient during office hours or after hours is having an issue and being followed by a navigator, the navigator can go out. Using their Skype for Business, they can communicate back and forth with the patient. And if they're in the field, the Skype for Business can bring in the psychiatrist, the medical doctor, the nutritionist, everyone to address things that are not urgent. If there is a medical issue, we're working with Tidal Care. We're the first team in New York State to do that. And what that happens is we can have an after hours or a provider back at Urban that can get on the system and basically guide the information for the patient. The Tidal Care is interesting because if you're sick, we can actually get a temperature, look at your ears, your throat, the video comes in, we can listen to your lung sounds, heart sounds, and you're getting blood pressures and temperatures, almost a virtual visit at home. That comes into our providers, and basically we can manage. If we find that the patients can do well with that, that's enough. If we find that the patient may need to come in, we can bring them into after hours. And if that patient really needs an extra service, we can either direct them to an urgent care or the emergency room. But I think what it gives patients is choices, which they haven't had in a long time. One of the things also is we did a third-party TalkSoft sort of a evaluation how we do as a system. And based on all the questions you can see on our graph, we improved. And in some cases, in GBOM, we were better than the national average. So, and remember, the national average a lot of times is 95. So it's not a low number to kind of get to. So we've done pretty well in all the categories. And we always try to tell our PHNs to really look at those categories, because every time the patients are scheduled, on our schedule, there's a call that goes out to them that's asking them about the services that we've been providing. So the other two components that we want to kind of add in is the wellness component that continues to kind of grow. We have about 200 people that come to the wellness section every week, and what's happening there is we have our trainers that are doing a really good job. People are in programs. We're seeing dramatic weight loss. We're seeing people more engaged as a result. Their behavioral issues are improving, and we've been tracking that. going forward. Nutritionists, we have a new nutritionist that's actually working and trying to make sure the diets are being followed and really engaging the team so that you're focusing on the diet and also on the exercise as a system. And that's been fairly well. We've been seeing drops in hemoglobin A1Cs of 0.3%. We've been seeing blood pressure drops of 7.5%. And remember that a drop of 5 means significant sort of reductions in risk when it comes to strokes and heart attacks. So those changes that are just coming in by diet and exercise mean a lot to the individuals. I think the last piece that we talk about is also, we partner pretty well with Your Care, and we're aligning to co-brand, to co-market. We're using some of the facilitators so that at one point, if we have GBOM and a patient doesn't have insurance and needs access to it, we're partnering with Your Care to get them more involved with that. We find that Your Care has more of a caring component, and the reason is that organization was actually created by doctors, which is different than a lot of insurance companies. So that's one of the things that we found quite helpful, and they've been really remarkable working with not only Jabanco but GBOT and Urban Family Practices, the IPA. I think, again, the events that we were involved last year, and there were multiple, besides a fundraiser that we do, a golf tournament. We had, in terms of some of the events on the Lower West Side with health fairs, activities when it came to Juneteenth, the Puerto Rican Festival. We're really engaged with a lot of the social determinants of health and really touching people's lives. People talk about this now. We've been doing this for a while. And I just want to, give you a little bit of an assessment of what we did in 2018 when we built this dream, and now activating it. We'll see what 2019 brings us, but it's only better and better. Thank you.